with the Utrata forceps and continue that tear. You can see one quadrant was torn, it's regrasped and then brought around till approximately 12 o'clock and then usually regrasped again and then completed from the 12 o'clock position back around to the 6 o'clock position, where it becomes continuous with the initial tear that was created. Here is the hydrodissection with BSS. You could see the waves sweep across underneath the nucleus. We do it usually on both the nasal and temporal side. We may attempt to hydrodelineate it by just trying to press the needle tip into the nuclear core a little bit to try to separate the central nuclear core from the softer peripheral rim. Now the 30-degree bevel on the CooperVision 10,000 is then inserted, and when possible it's nice to extend a little notch under the anterior capsule inferiorly. This is the point where you obviously run the risk of either rupturing the capsular rhexis or even engaging a little bit of the iris, and you have to be careful how far inferiorly you extend that. But if you can safely do that, I think it does facilitate the fracturing of the nucleus. So now we've thinned out. You can see a little couple of passes on either side of the nucleus, nasally and temporally, were performed. That just permits the sleeve to slide down so that you can make the groove a little bit deeper. As long as the walls of the nucleus are fairly steep and the groove is cut no more than, say, 1.5 tip widths. Now this is the disadvantage, I think, and you can see it in this case. It's often difficult to spin this nucleus. Even though we've hydrodissected it on both sides, you can see that this is sort of resisting that maneuver. Finally, we are getting it to rotate around, and once it's rotated around, we'll then start to cut another groove inferiorly, and then you just keep working your way around until you have cut, in effect, 2 grooves perpendicular to each other. Now we're rotating it another time to complete the vertical groove inferiorly. When this is really done properly, you should end up with a sort of Maltese cross appearance to these 2 grooves. Once the 2 grooves are completed, then Helon is inserted again to protect the cornea, and the splitting forceps will be introduced. If you have cut a double groove like this, you'll see that it can be an advantage to actually keep the spatula in the side port. Now that here are the 2 grooves and the Helon is being inserted again, the forceps are introduced and the spatula is left in position with the left hand. The first fracture is attempted, and you can see the cleavage. It's kind of narrow, but it did split. You can see the fissure at the depth of the groove. Now the spatula is used to rotate. Remember, there's Helon in the eye protecting you here. It's rotated again 180 degrees, and the forceps are then used to make the second fracture, which hopefully now has split the nucleus into 4 separate pieces, as was originally described by John Shepard. Now with the Shepard technique, you have in effect 4 pieces of the pie. You can spread it a little bit with the nucleus, with the spatula and the Phaco tip, to make sure that you have cleavage. And then the idea is to depress the apex of the pie posteriorly and inferiorly, and in effect flip that piece of pie so that the peripheral part comes central. Here you can see it's not quite coming, but as we keep pressing on it, and sometimes you can sort of grasp it with the Phaco tip to help it around, but what you're really trying to do is to get that peripheral nuclear rim central, where you can see what you're emulsifying, rather than having to try to emulsify that when the pupil is partially constricted. Now we've got it, and that quadrant is now flipped around so that it's very easy to aspirate that quadrant. Once you can accomplish that little flip, you basically have it made then, and this also gives you room to maneuver the rest of the nucleus once that one quadrant has been emulsified. Now we're going to rotate a second quadrant into position. We're going to separate it again to make sure that there is a fracture, and try to depress the apex of that quadrant and move it inferiorly and peripherally, trying to flip around the peripheral nucleus and make it become more central. So we're trying to line that up right at 6 o'clock to get the best angle at it. It still hasn't tried to split. Now we're trying to use the Phaco tip to help that around. We're checking to make sure that it is fractured from the other piece that can hold it up. Still hasn't quite come, but it's almost ready. So now we have 2 additional pieces by completing the fracture with the two-handed technique. This will now again be rotated into position so that we can try to bring that nuclear fragment into the center of the pupil if it's at all possible, where it's safer to emulsify. The danger in these techniques is trying to emulsify in the area underneath the iris, under the capsular excess, where the convexity of the capsule at that point is in close proximity to your Phaco tip, or 180-degree fracture techniques end up being much clearer because of the location of the emulsification more posteriorly and away from the cornea. Now we're getting the nuclear shell, which is pretty much just being aspirated, and I think you can see nicely that even though this was a dense nucleus, that capsular excess is round and is intact and did survive these maneuvers.